It's that time of year. CMS released their proposed fee schedule for the upcoming calendar year. In this video, we'll talk about some of the things that we're really excited about and some of the things that we're not too happy about as well. But this is only a proposal and there's a 60-day comment period. We'll also share some of the feedback that we plan to share with CMS, and we encourage you to do so as well. So let's dive in. Hi everyone, this is Dan with ThoroughCare. On July 10th, CMS released their proposed rule for the upcoming physician fee schedule. First, let's start with something good. There's a new program being proposed called the Advanced Primary Care Management Program, or APCM. This program is similar to programs like chronic care management, remote patient monitoring, except it's not based on the number of minutes that are completed. It's designed to function like a value-based care program where providers and their staff would get a flat reimbursement regardless of the number of minutes spent. While this can be an advantage for some groups who've had trouble getting 20 minutes, the reimbursement rate is slightly lower than that of the minutes-based code. At ThoroughCare, we're still looking into this program to see the pros and cons, and we'll share our recommendations with you once we know more about what this new program entails. For those of you who are rural health clinics or FQHCs, there's some good news for you as well. As you know, you've had your own G code, G0511, for General Care Management. While there are pros and cons to doing this, the rate was a little bit higher, but you really never got to take advantage of the higher minutes codes. Well, this proposal is something that we think you'll really like. The proposed rule is that going forward, RHCs and FQHCs could bill like regular fee-for-service clinics. That means you'll be able to use codes like 99490 and 99454 and 99457. This allows you to take advantage of those individual codes and bill many of them together. ThoroughCare has been encouraging CMS to do this for the past several years, so it's exciting to see this in the proposal. While some of you might be shocked that the rate would be a little low because, let's face it, RHCs and FQHCs did get a higher rate for general care management, the ability to do multiple programs in any given month will far outweigh that slightly reduced cost. So we're very excited about this one. And once this is proposed, we'll have a webinar for rural health clinics and FQHCs where we talk about how to plan for these changes in the coming year. Now for some things that we're not too excited about. Number one, Remote Therapeutic Monitoring, or RTM. Every year we hope that CMS will come out and clarify that this can be billed together with RPM. Well, we didn't see that in the proposal. Also, this code has always been limited to musculoskeletal and respiratory conditions. We're still hopeful that one day they'll make that a general program code, but as of now, we didn't see anything about it in the proposal. Hopefully, when we share our feedback with CMS, they'll consider it and possibly get this into the final rule. The other area that we're not really excited about is that there's a proposed rate reduction of 2.93% starting in 2025. While they're not really reducing the rate, there's an increase that's expiring going into 2025. Now, it always is possible, and it's happened many times in the past, where Congress can step in, they can postpone that. Our feedback when we submit it to CMS will be to keep those rates as high as possible and postpone any potential reductions for as long as possible. As I mentioned earlier, CMS is opening up a comment period between now and September 9th. ThoroughCare will be submitting comments on behalf of our clients, but we encourage all of you to do so as well. If you'd like to submit comments of your own, we highly encourage you to do so. If our team can help in giving you some bullet points or advice on what to say to CMS, please feel free to reach out to us. We'll be happy to share our comments with you. While this video is to just share some highlights of the rules, we'll actually be diving further into a lot of them in the coming months. So make sure you follow us on social media and subscribe to our blog as well. If you found this video helpful, we invite you to subscribe to this channel and like the video below. Thanks for watching. Goodbye.